Hello, everyone. I'm Dr. Sarah Taysir. I'm a pediatrics and neonatology specialist and healthcare consultant on MedSynapse Medical Platform. Today, I'm pleased to have Dr. Amr Sallam with us on MedSynapse podcast. Dr. Amr Sallam is a medical advisor and healthcare management specialist. Welcome, Dr. Amr.
Hello, Dr. Sarah. Thanks for having me today, and thanks for MedSynapse.
Thank you. So today we're going to talk about a very interesting topic, which is preventive medicine in workplace. But let me first ask you about your medical background. Can you tell us more about you?
Okay, my name is Amr Sallam and I'm a physician. Okay. I have been working within the insurance industry and corporate health and occupational medicine for the last 5 years. Okay. And I have gained my postgraduate within the quality management and healthcare management.
Okay, so this is great. Let me first ask you about preventive medicine. How does preventive medicine contribute to the overall employee well-being and productivity?
Before we start to talking about the impact of the preventive medicine in workplace, let me ask you a very simple question to highlight this importance of the preventive medicine on our employees.
Okay.
If we would ask a healthy employee about what he wants the most, I believe we will get many answers related to it could be a promotion, could be a successful implementation of his project. Yes. He might need an increase in the salary. Yes. On the other hand, what do you think if we asked him when he's ill or he have a health issue? What would be his answer?
Yes, he wants to stay in a healthy environment, to be in a mental status, which is a health mental status. He wants to feel secured. He wants to feel listened by his employers. He wants to have his employer supporting him when he is sick or ill.
Yeah, sure. This is emphasize the importance of our health and our well-being and how it affects our workplace businesses and our work. Therefore, we need to focus on prevention is better than treat.
Yes.
Or as we said in Arabic, الوقاية خير من العلاج.
Exactly.
This is so by enhancing the well-being of our employees, we will increase their productivity, their satisfaction. This will lead to reduce the absenteeism rate. Also, the more employee good health have, the more engaged, the more motivated, and the more productive they will be. Therefore, all these factors will lead to a more satisfied employee, a more moral and more productivity. They will have impact on our business.
Yes, I completely agree with you. So what do you think are the most common health risks employees face in today's workplace?
According to the statistics published by the WHO and the European Union, the musculoskeletal disorders is one of the most relevant causes for work-related diseases. It's responsible for around 60% of them. This could be a carpal tunnel syndrome, a back pain, arthritis, often caused by repetitive tasks or poor ergonomic workplace. The other important health risk our employees face is the mental health. Especially with our accelerating world these days and some of the financial difficulties we have, the mental health responsible for around 15% of working adult age having a mental health disorders.
It's a big percentage.
It might be a depression. Yes, it's a very big percentage and have a huge impact of our global economy. It might affect with around $1 trillion on the global economy each year caused by the mental health. Of course, in addition to the obesity and sedentary life, all these factors could affect our employee health.
Okay, and what preventive measures can be implemented to address these risks?
To be able to address this risk, we need to implement a comprehensive approach. This is very important to be able to doing a risk assessment and identify a focus area according to each workplace. However, starting with a good economic assessment, this is one of the most important investment you could do in your workplace. actually a well designing of the workplace ergonomics, from the chair you are sitting on, to the light, to the support for your back, support for your wrist. It can boost your productivity by around 25%.
Wow.
This will lead to reduce the turnover and increase the retention of your employees.
Okay. And regarding the mental health, how important is mental health in the context of workplace health? Because we mostly focus on our physical health, not our mental health. So what do you think about that?
Although most of the focus on the of the physical health, however, mental health can also contribute and have a huge impact on our physical health.
Yeah.
So it will have a huge impact, sometimes more than the physical health.
Exactly. Yes, you're right. So, and employers, do you think that employers can have a role in preventing some diseases or taking care of employees' health? How can employers effectively communicate the importance of preventive health to the employees?
This is a very important question, because sometimes the preventive medicine and the preventive health programs and well-being programs, it's a strategic investment. You need to get a good return on investment, either a financial aspect or on the employees' moral satisfaction and health. The first step is demonstrated support from leadership will have a huge impact on the employees.
Yes.
And by highlighting the importance of the preventive health on their productivity and overall job, it will lead to more participation and more buying in from our employees to participate in these programs. Sometimes offer incentives. It will be a very good communication to more participation in our programs.
And do you think nowadays most of the companies and organizations, I guess from my own point of view, that they are taking care more of the employees' health and well-being, and this specific subject is becoming very important because I guess many employers now can see or can relate how important is to take care of our employees' health and well-being, as you said, it affects directly on the work outcome and the production, right? So Dr. Amr, how can employers measure the impact of preventive medicine initiatives?
Okay, there is a ground rule in the performance management and the quality management. What we can't measure, we cannot manage, and we cannot improve.
Yes.
Therefore, measuring is very important. We should have a clear metrics, a clear KPI to determining the effectiveness of our program and justifying this continuous investment.
You're
One
right.
of these metrics and measures, we should the reduction in the chronic diseases and the prevalence of these chronic diseases and its impact. And sometimes it affects the direct health cost, the rate of admissions to the hospital, the rate of side effect caused by this chronic diseases.
Yeah.
Also improved in the biometric data like the blood pressure, cholesterol, body mass index. This is also a very important metrics we should measure. Yes. On the level of the employee engagement, the participation rate and the employee satisfaction. The more satisfaction we have, the more participation we will have, the more effect we will have on our employees. And the more important part for our top management and on the business wise is the financial cost, how it will affect our budget every year, how it will affect the health cost. Yes.
Dr. Amr, you should go and give some sessions about preventive medicine for different organizations, as this is very, very important. And what you're saying is important for the top management to know and to implement it actually in the workforce, because they in the workplace, as this will positively reflect on the work outcome and productivity of the employees. So this is very important.
It will affect our global economy.
Yes.
For sure.
Yes, exactly. Dr. Amr, thank you so much. It was a very, very informative session and interview, and I'm looking forward to do more podcasts with you. So I would like to know more about the health and well-being of the employees and more about how nowadays employers can take care more of the health of our employees. So thank you so much for having you today on MedSynapse podcast.
It would be my ultimate pleasure, Dr. Sarah, and thank you very much, and thank you for messaging.
Thank you. Have a
Bye-bye.
great day.